Hey everybody, welcome to PermanenteDocs Chat. I'm Alex McDonald, your host, and I'm excited to welcome Dr. Maria Koshi, who is a psychiatrist from the Permanente Medical Group up in Sacramento. As you all know, hopefully, May is Mental Health Awareness Month, and today we're going to be talking about all things mental health. We're going to keep this short and high yield. It'll be about 20 minutes or so. So if you have questions, please drop them in the chat or in the Q&A box on Zoom. If you're on Facebook watching this, drop them in the Facebook chat as well. We'll try to get to some of your questions also. So Dr. Koshi, thank you so much for joining us. Let's just start off by telling everybody who you are and what you do.
Thank you. My name, as Alex said, is Maria Koshi. I'm an outpatient psychiatrist treating adults in the Sacramento area, South Sacramento to be specific. I have been with KP since right after I finished residency at Emory and became chief of my department a few years after I joined, and I'm now chair for the mental health service line here in Northern California. And I have really appreciated the system of care that we have in the Permanente Medical Group, especially as it pertains to how mental health care is just integrated into everything that we do and how we as a system really are able to address the whole person and prioritize and understand the value of addressing mental health within the bigger picture of any individual's medical well-being. So it's been just an amazing journey so far, and I'm happy to be here today.
Great. Well, thank you so much. Do me a favor, actually, so you're much better. Thank you. So I guess I should continue also. Before we go on further, I should give a disclosure. I'm actually married to a psychiatrist who's actually, well, she's a child psychiatrist as well too. And I like to say that I'm childish and crazy, and she's a child psychiatrist, so it all works out well. So we have lots of conversations about mental health in our family. And then furthermore, as a family physician, I deal with lots and lots of mental health in my daily practice as well too. So I guess I should make those disclosures before we continue. It really feels like right now as a nation, we're finally beginning to realize and address the critical importance of mental health. And it's no longer something that we don't talk about. And people are becoming much more open about their mental health struggles. And we're becoming more cognizant of the impact that mental health plays on our physical bodies and our overall health as well, too. So how has this sort of change and I don't want to say resolution, but change in the stigma of mental health and mental health care, how has it really changed how we care for our patients and how psychiatry really integrates with primary care as well?
I think it's been such a welcome change. I would absolutely agree that the stigma around seeking care has definitely decreased to the point that we're seeing just a huge rise in demand for mental health care services. It's a step in the right direction in that people are just more comfortable voicing that they have ongoing issues, or being able to label what they're going through as being related to mental health, because that's often a challenge as well. Because primary care physicians are always actually the front line when it comes to anything related to mental health. A majority of those first conversations around mental health and emotional well-being take place in your office, Alex, and the offices of hundreds of other physicians across the system. And so it becomes really important to be open and accepting and create a safe space for the person sitting across from you to be able to discuss this. And it also becomes important to be able to evidence and show some level of comfort around discussing this, and to be able to stay with the patient in that moment. Overall, as a system, there's been and as a community, there's been such a rise in resources available for anyone dealing with mental health symptoms of any kind on the spectrum, from going through some distress psychologically to having really severe issues. So that's a good thing. There's a lot of resources out there. It can sometimes be overwhelming because you may not know how to access those resources, or which one is the best for you. And I think that's where, we as medical providers come in, and really can help our patients navigate, what is the best level of care, what's the best resource that they can access.
Yeah, I think that's such a great point, and something that I've seen in my own practice, and I know that psychiatrists are likely seeing kind of everywhere, is that increase in demand. And how do we care for every patient? Does every patient need to see a psychiatrist? Like, can they see their primary care doctor? Can they see a therapist? Can they work on sort of a lot of these sort of self-help tools and modules as well too? So I think that's such an important piece about helping people kind of get the right care at the right time in the right way, right? Versus waiting too long to get care when they really need care sooner. So certainly a challenge, to say the least. Tell us a little bit more about some of the innovative ways and programs that the Permanente Medical Group is doing to outreach to patients and helping them kind of raise awareness about their mental health, but also getting them those right resources too.
Absolutely. One of our strengths as a system is that we are able to look at the health of the population as a whole. I know that in primary care, there are so many population management programs that really, provide that all-round care to the patient and track and make sure that they're accessing the care that they need. In mental health and specialty mental health in the last couple of years in Northern California, we've launched several population management programs for mental health, one geared specifically towards depression and anxiety, based on the collaborative care model that has extensive evidence behind it. We launched that program a couple of years ago, and we've been scaling up, and it provides care to thousands of members across the region for who have mild to moderate depression and anxiety. On the other end of the spectrum, we've also launched a population-based program for patients with severely and persistently mentally ill diagnoses, so schizophrenia, psychotic disorders, bipolar disorder. And the premise behind this program and the need for it is based on the evidence that we have that those with SPMI, or severely and persistently mentally ill diagnosis, their lifespan is often 20 to 25 years less than those who don't have that diagnosis. And it's related to just not being able to function well enough to be able to manage all the different other aspects of health, such as diabetes, cholesterol, hypertension, and all those things. So we have, a very multidisciplinary team of people reaching out to patients with these diagnoses, encouraging compliance, encouraging, providing reminders for preventive health measures, and so on. So that's been another program that we've been working through on the care delivery side. And then, of course, just organization-wide, there's been so much more opportunities for conversations around mental health, both on the web pages. When you go sign into my kp.org, when I sign in, right there with Get Care Now and all that is how to access mental health. And it's just become a very visible delivery, arm of care that's being delivered, and it's hopefully much more easier for patients to access.
No, that's such a great point. You kind of hit the nail on the head, and wearing my family medicine hat, I like to think about it, and I didn't coin this term, but one of my much smarter colleagues talked about mental health really being a catalyst for all these other physical health problems, because your mental health, your mental health and your physical health are the same, and we don't sort of make a distinction. I think that's really important. But when someone who's anxious and they're dealing with chronic anxiety, it often causes their blood pressure to go up. It often causes them to come in for extra visits when they're sort of the worried well, so to speak. and then further, then leading to unhealthy habits such as excessive alcohol intake or smoking, which we know further impairs your physical health as well too. So that the mental health is such a catalyst for all these other issues too. And so if we can kind of get to the root cause, I always joke, and I don't necessarily joke, I say in family medicine and primary care, probably about 80% of what I do has some underlying component of mental health. It may not be the main component, but there's some piece in there too. And so I could go on my soapbox for forever about that one. So we'll try not to go too deep down that rabbit hole. I wanted to ask you real quick. One of your comments made me think about a lot of the sort of the self-help tools and a lot of the app-based systems out there for mental health care. What are some of your thoughts about that? Because if we can get somebody to kind of engage with a self-help app on their phone early in their mental health process, we may be able to sort of nip that in the bud and help keep them and restore them to health sooner. So what are your thoughts about sort of a lot of these apps that exist in the world these days?
There are so many of them. Well, through KP, we get free access to Calm and other apps. And so they are helpful in that it's just very easily accessible tools to engage in self-help. Now, in terms of outcomes, the kind of outcomes that we would need to see, likely, we can get there likely by pairing the app with a coach or with someone to really encourage patients to engage in using the app. Because, we all know that these days, everyone's attention span is 2 minutes or less, right? So, so it's the same thing with the apps. It takes consistency to learn mindfulness. It takes consistency to be able to learn it and then practice it and then implement it when you need it. And so I think the apps are really great and they fill a need. I think integrating and incorporating them into clinical practice is maybe perhaps the area where there's a lot of room to really move the patient or member or move yourself along in that journey of wellness.
Yeah. I think it's certainly so multifactorial. I think that's the pairing with the coach, I think, is a really unique aspect, and I think that makes a lot of sense. I haven't heard that specifically before. So I want to switch gears a little bit to clinician and nurse and pharmacists and physician mental health these days. Obviously, we've gone through a lot in the last 2 years with the COVID pandemic, and it certainly tested a lot of us in new and unique ways. And what are some sort of mental health concerns that or mental health challenges that you think healthcare workers are sort of facing right now, and how we can kind of get our own help and kind of attend to our own needs to make sure we stay mentally healthy so we can best take care of our patients as well?
What a journey it's been if you've been in healthcare for the last 2 years. And it's just been very universally traumatic, for lack of a better word. It's, as a society, while we've all been dealing with the sequelae of the pandemic, be it, having kids learn from home. I had a kindergartner trying to learn from home by video, or if it's, not being able to see family members for a long period of time. Or not being able to access regular support systems and groups that we normally would engage with for support, camaraderie, be it what it may. So it's just, that's been difficult as a society. And then to add to that, as a healthcare worker, we've had to hold the suffering of other people. And depending on which field of healthcare you're in, I know for psychiatry, in psychiatry, it was dealing with our own fears and uncertainties, fears about the uncertainty that existed in the last 2 years, but then also holding that for all our patients. And that in itself, it's a heavy burden to carry. I know that my colleagues in hospital medicine, it was holding not just their own fear for their family's health and safety, particularly when they were on the front lines with exposure to COVID, but then also being on the front lines and, helping patients and families navigate through loss and grief. So it's been an unimaginable burden as a healthcare provider in the last 2 years. Typically, when going through a trauma, people are in survival mode. When the trauma is settling down, that's when the processing begins. And for a lot of us, this is the period of processing. And how you work through this and how you build resilience from it, really, it's crucial. This period of time is really crucial because that dictates how you process and how you build from it. It's really important to stay connected to your colleagues and others who've been through what you've been through. It's really important to create structure and space within even your teams at work to say, here's what happened in the last 2 years, because we never really pause and reflect, right? So it's important to create that structure and space and say, here's what happened in the last 2 years. Here's what we went through as a group together. Here's what was perhaps some silver linings. My gas bill has gone down because of the work from home. And here's what was really difficult and challenging. And in that shared experience, you're not as alone anymore. And so that's really important to do. It's also important to create that structure and space in your personal life. So when, in the last 2 years, when you're in that mode of having to do so much, a lot of us just ignored all those boundaries of, when I'm done with work, I'm done with work. And then I come home. It's just because the need was there. And so now is the time to start working and setting up those boundaries again, particularly because we live now in a world where we are working from home, and it's so easy to just, spend a little extra time when the computer is right there. So it's important to be intentional and structured about creating that space in your personal life as well. And then be intentional and structured about re-entering society. As anxiety provoking as it may be for a lot of people, it's important to keep trying to re-enter society because we're all, social beings at the end of the day, and those human connections are what keeps us going.
Yeah, that's such a great point, and that actually dovetails sort of perfectly. And you touched on this a little bit to one of the questions we just got in the chat about sort of the reports of sort of this endemic of loneliness, and especially during the peak of the pandemic when so many people felt isolated. Are there any specific new approaches or tools to address this sort of isolation and loneliness challenge?
Well, technology, it's often a double-edged sword. I think during the pandemic, it offered us so many opportunities to connect with other people in a way that was safe and healthy. At this point, though, I think, it's important to start to lean in, like I said, to connecting more with people in person. I can't think of any tools to help with connecting in person other than, again, to be intentional and structured about it and commit to reaching out to, one person a week or one person a day, whatever your bandwidth allows, who you just have lost touch with during the pandemic. And I know all of us have probably lists and lists of people that we used to interact with on a regular basis and just have lost touch with. So just be intentional about stepping back into connecting with other people.
Yeah, that's such a great point. Just sort of being intentional about what we do and how we reconnect. We only have a few minutes here, so maybe one or two more quick questions. As physicians, we're all leaders, right? Be it within our house, within our clinics, within our organization. How can we help support each other in our own mental health journey and recovery here as we come out of this pandemic? Is there something specific that we can do as leaders within you name it, that can help support others in their own mental health processing?
It's an interesting question because I'm a psychiatrist. Years and years of training on how to talk to patients about mental health and how to help them in their journey. I will say though, it's a whole another ball game trying to talk to someone in my personal life who I'm worried about and am concerned about, and they may not, you know, be at a point where they want to come to me, but I'm worried about them. And then trying to figure out how to approach that conversation is, it's different. It's not the same as being in, your office at work and having someone who's seeking help being there and trying to talk to them. So I would just encourage all of us to look around us and look at the people, really see the people that you work with and just really see how they're doing and check in. It doesn't have to be a conversation about mental health. It can just be, how are you doing? And then when you get the routine, I'm fine, then really say, how are you really doing?
Right. Yeah. How are you? I think it's so easy. It's to say, oh, I'm great, I'm good. Yeah. But to really ask that question, I mean it too. That's so important. All right. Last question real quick here. We're out of time here, although we could go on and on. Tell us what makes you most proud to be a Permanente physician.
I cannot think of another place to work at where this is a physician-led group, and the added element of focus on the member and on what's clinically best for our patients is something that I value deeply. And it makes my job as a leader in this organization deeply fulfilling.
Wonderful. Awesome. Well, thank you so much for joining us. I really appreciate it. Thanks for everybody who joined us here on the Zoom and everyone on Facebook and social media. Our next Permanente Docs Chat will be Thursday, June 2nd at 10:30 a.m. Pacific. We'll be talking with Dr. Alex Mentor, a fantastic first name, by the way, a medical oncologist with the Colorado Permanente Medical Group. We'll be discussing clinical cancer trials at Kaiser Permanente ahead of the Kaiser Permanente Fighting Cancer Symposium as well too. So thank you so much for everyone who joined us today, and we look forward to seeing you in a couple weeks.
Thank you.